Bismillahirrahmanirrahim. A'udhu billahi minash shaitanir rajim. I start with the name of Allah, who is very merciful and beneficial. The topic of CME today is a brief review of what are the important points you have to remember while examining a case of hypertension, and especially pregnancy-induced hypertension, which is briefly known as preeclampsia. Pregnancy-induced hypertension is the hypertension 130/90 in the second trimester, 2 times of 2 weeks apart. These readings more than 130/90 2 times 2 weeks apart. And there are few reviews of preeclampsia. Gestational hypertension, pregnancy-induced hypertension. What are these? This is gestational hypertension or pregnancy-induced hypertension or chronic hypertension or preeclampsia superimposed on chronic hypertension, renal disease or preeclampsia itself. While, as you know, eclampsia is a life-threatening condition characterized by unconsciousness, fits, convulsions, seizures, uncontrolled hypertension, albuminuria, albuminemia in the fulminant setting of preeclampsia, and it's a very life-threatening condition, and it can lead to highest mortality and the morbidity both in the mother and the babies, also morbidity as well. The mortalities are due to the cerebrovascular accident, the thrombosis, embolism, and hemorrhage, and the other are the HELP syndrome, elevated liver enzyme, low platelets, and disseminated intravascular coagulation, renal involvement, and increased LDH, and other deranged profiles, hematological profiles. The renal failure also, and the important is the nephropathy and disseminated intravascular coagulation, which is the hallmark of these HELP syndrome. And then for the babies, can also lead to the death of the mother, death of the baby, and the morbidity of the babies are growth restricted child and also intrauterine growth restriction plus oligohydramnias, which already leads to the stress on the baby. It's already growth restricted. So just we will talk about a brief review of these some of the important features of the examining a case of hypertension and pregnancy-induced hypertension and preeclampsia. Starting from the up, you have to see in a patient the signs of steroid intake drugs like corticosteroids, which is very common, Cushingite face, moon face appearance, obesity, increase in weight, increase in blood pressure, and also can lead to increase in sugar. And then you can find most important thing in the eyes. These are the retinopathies. The fundoscopic examination is very essential hallmark of examining a case of hypertension, whether it is a essential hypertension, primary hypertension, or secondary hypertension, or it is a pregnancy-induced hypertension. The chronic changes you will find in the hypertensions are, number one, are the silver wiring appearance of the vessels, AV nipping, and last of important is the blurring of the disc, that is the papilledema, that leads to the severity and of the end organ damage, and the same finding can be there in the glomerulonephritis and in the glomerulosclerosis. So fundoscopy is a very important part. Eyes, you can see the chronic changes of anemias, pallor, and sometimes jaundice. And then in the nose, in the lips, you can find, and the tongue, signs of central and peripheral cyanosis maybe due to chronic hypertension leading to left heart failure, leading to right heart failure, congestive cardiac failures. Face, you can also see malafresh of the SLE, systemic lupus erythematosus with joints and increase in hypertension. Lupus anticoagulants is also an important factor in the pregnancy-induced hypertension, leads to recurrent miscarriages, and for that aspirin and heparin are being prescribed, and it has a very safety profile rate, and it prevents these recurrent miscarriages because there are microthrombi which are being treated by this anticoagulant therapy. And then goes down, you have to check in the neck. Most important are the JVP, raised in JVP in the congestive cardiac failure because of the underlying chronic hypertension, and also the pulsation, and especially the carotid pulsation. And you should not miss the thyroid gland, nodular gland, or signs of hyperthyroidism, exophthalmos, or hypothyroidism. Hyperthyroidism leads to increase in the pulse rate and sometimes leads to arrhythmias. The commonest arrhythmia associated with hypertension is atrial fibrillation. The first thing you think of this irregular pulse, regularly irregular pulse, is the atrial fibrillation associated with thyroid, or can be with the mitral stenosis. And then comes the hypothyroidism, which leads to mostly the failure of increase in the weight and the depression. The hyperthyroidism, anxiety, systolic blood pressure, sweating, palpitation, diarrhea, and loss of weight. Then come down, and then you find any signs of surgery on the chest. Important are for the congenital heart disease and for the especially CABG, coronary artery bypass grafting. Of course, you can find the third heart sound and some murmurs, and then you can also find at the back the basal crackles, which are hallmark of the left ventricle failure, and also you can have V's also. And then you go down, of course in the fingers you will be seeing the same findings of the pallor, anemia, koilonychia, paronychia, and the general features. And in cases of SBE, subacute bacterial endocarditis, there are the splinter hemorrhages, not particularly important to hypertension, but in case of SBE, and the Genival lesions also. For the pulse, you will see the regularity and the irregularity, the volume, and then you will notice the atrial fibrillation, irregular pulse, and also you can have regularly irregular, that is misbeats, PVCs, premature ventricular contractions. Of course, then you will see the ascites, abdominal distension, and hepatosplenomegaly, pulsatile liver, and then also you have to see the signs of Bruhi, renal artery stenosis, which is very important, and for the aortitis, the vasculitis, aortic Bruhi also, and the venous congestion, venous hump. For the liver, pulsatile liver, in case of congestive cardiac failure, which can be present due to congestive cardiac failure. Of course, at the back I have mentioned fine basal crackles and sacral edema, and in the legs sometimes there is unilateral swelling and can be a hallmark of the deep venous thrombosis or the varicose veins or edema, sacral edema and the ankle edema, and then also in the legs. And then you can find also xanthomas, and up on the face near eyelids there are xanthelasmas, lipid filled deposits, and big filled lipid tumors on the shin of the bone of the legs, xanthoma. These are due to the cholesterol, increase in the cholesterol leading to the hypertension, which is basically the pressure exerted to the lateral wall of the vessels, great vessels and small vessels. And then of course in the foot can be signs of diabetes. Sometimes diabetes is associated with the hypertension, and the signs of peripheral cyanosis, and then edema, as well as changes of pallor koilikia. This is a very brief review of the examination and the hypertension, of examination of a case of most important points in relation to examining a hypertension, whether it is essential hypertension or recap. Recap means renal glomerulonephritis, glomerulosclerosis, renal artery stenosis, and then essential hypertension and the endocrine hypertension due to Cone syndrome and hyperaldosteronism. And then also you can have this Cone syndrome, and then connective tissue diseases, SLE the most important, and then P. This is due to pheochromocytoma. Tumor in the adrenal medulla leads to systolic hypertension, very resistant hypertension, and for that we use the specialized drug. This is phenoxybenzamine and the beta blocker Indirol. And then comes so these are one of the very few causes of the secondary hypertension: renal, endocrine, connective tissue, and vasculitis, pheochromocytoma, and aortitis, and essential and secondary hypertension. Renal is the most important. I told you, glomerulonephritis. So I will have another review regarding to the eclampsia, preeclampsia, gestational hypertension, and its four classification: preeclampsia, superimposed on chronic hypertension, superimposed on chronic renal disease, and gestational or pregnancy-induced hypertension. Keep up the CME post-graduation, especially in the obs and gyne. Important takeaway message is always pray, praise, trust, love, and Allah, God Almighty, and follow Suasna lifestyle of Prophet Hazrat Muhammad sallallahu alaihi wasallam, the survival and the health of our life. Wama alayna illa al-balagh. Thank you very much for your patience listening. We'll come with another review related to the cardiovascular or any other topic. Thank you very much.